My name is Monika Nugent, and I'm a mother of 3. I am 52 years old. My middle son is 25 years old, a gentle giant. He's severely autistic, nonverbal, has epilepsy, pica, meaning he ingests non-edibles. He has sensory issues. He will elope and run off. He does not respond to verbal command, which can be dangerous. He is 175 pounds in diapers and can exhibit extreme behaviors. He lives full-time at home. I am his full-time caregiver now after leaving my job at Danbury Hospital for 17 years. My husband of 31 years of marriage is the only income that we have. We have had lost our home. We've suffered quite a bit. My son, just the damages that he has caused from these behaviors are tremendously expensive. We had dealt with physical abuse in school systems. No therapy for that, no kind of help for him, no justice. Once he aged out of high school, there was no programs or anywhere for him to go, so that's why he resides at home with us. During COVID, they offered the Appendix K, which temporarily gave us like 30 hours a week from what I understand, from what I remember, and it was approximately $15 an hour, which actually helped tremendously. I ask here today for your support for the families of severe disabilities. The extreme, difficult job that we do 24 hours a day with no breaks is detrimental. No one should be asked or forced to do something such as giving up our guardianship in order to simply afford to be able to live, to take care of our severely disabled adults that live at home, to keep them safe. So I ask you for your support today on passing this bill to be compensated for the job that no one else can or will do. I thank you for hearing not only my story, but others that are living in silence. I'm also told that the DDS budget, if you don't use it, you lose it. They review it every 3 years. And if we're unable to find adequate staff or any staff because of the staffing shortage, then why should that affect us? They have a budget, whether it's to pay a stranger or to pay a legal guardian. We're here doing a job that's 24 hours a day. We would have to staff at least 3 large men to be able to do so, and we're actually going to be saving the budget by having a legal guardian do that job.
And we want to support parents like yourself. How do we set up, how do we get us there? And does that look like a pilot program, or what could that look like? And so I'm not asking you to have figured out the Connecticut budget situation, but I was just wondering if by any chance you had suggestions for us about what's the lowest hanging fruit. Yeah.
Well, first of all, if somebody else in the family other than the legal guardian is able to be a paid staff, then why can't it be? What about the people that don't have, like, I have another sibling. I mean, my son has a sibling, another child that I have that's able to help me sometimes. But he needs to move on with his life and start moving on. It's not fair for him to have that responsibility. If they're able to do that for them, what's the difference? I don't understand why it is crucial to give up guardianship. I don't have that answer. I think it's kind of crazy to do so because it's detrimental to their well-beings. One of the things my daughter had mentioned, she says, I can see where the state would kind of, what about the people that might take advantage of it? So she says, why don't they just do it for certain individuals that are extreme and they could have to fit the criteria or get a doctor's note? I mean, that makes sense. I mean, right now the going rate for a PCA, they just increased it January 1st, is $18.25 an hour. And I'll be honest with you, I couldn't find somebody to do that. I have not had staff in years. And besides, if I was to hire a staff, I'd have to hire at least 3 grown, strong, educated, trained men. It's impossible to find one. So you're actually saving Daniel's budget by hiring one person, the one that's doing it right now. I don't know how long I'm going to be able to do this. I also have a question. Right now, my son helps me. What's going to happen when my husband and I pass on? he then will have to step down, render his rights as guardian in order to be paid to take care of him. Or he'll have to leave, and then he's in no different boat. There'll be no staffing to take care of his brother while he goes out and tries to support him. The financial burden that families take is so tremendous that I can't even explain. Losing your home, having to file bankruptcies just to live and eat, and just think, I have a husband. What if I didn't? Then what? I'm left just like others that are sitting home, having no supports, and having to deal with the behaviors, no programs. Even if they wanted to send their child to a group home, there is no group homes. There's nowhere to send their disabled, severely disabled kids to keep them safe. So technically, we'd be saving the state money.
DDS did offer that we are moving this way, as the senator said, and that the K option is there for us to decide if we want to facilitate it and move it forward. We're going to see the numbers and see what it's going to cost, but I think you're absolutely correct. I mean, we're going to see a savings on the side by having parents, because of the lack of employment out there.
It's the people. So there was something you mentioned earlier that I wanted to touch back on that came up earlier while you were listening to other people comment on other states having solely state-funded programs, and they weren't sure how many were there. Are you aware of how many other states that can do this?
I am. I had passed it along as well. It's 21 states that responded that solely state fund programs. There's 12 states, Colorado, Kentucky, Maine, Minnesota, New Hampshire, New Jersey, North Dakota, Oregon, Texas, Utah, Vermont, and Wisconsin, that these state-funded programs pay any relatives, including spouses, parents of minor children, and other legal responsible relatives. So our state is one of 7, but there's restrictions, such as giving up guardianship, which should never be asked of any parent or legal guardian to do.
Yeah, and I think when you talk about care itself, and you mentioned this was a $15 an hour piece that we're talking about.
Yes.
Which is where we're going now as a state for, all jobs as a minimum wage piece. The amount of dollars saved, I think, to the state in doing so is not only fiscally responsible to what we're looking at, but it's also so much. Who could possibly even consider providing better care for Daniel than you?
Mm-hmm.
It just doesn't exist. And you and Dave put a lot of work in, and I stand behind you on the fight.
I thank you so much, Bill,
100%.
and I know you've seen our family and our struggles, and we stand proud and we continue to fight, because if you meet him, he's a gentle giant, and when he has his behaviors, he has his reasons, and we just do it with the best loving care that we can. It's scary. We also, my son and I do most of the caregiving, and we both suffer from PTSD, because these behaviors can be very dangerous when he runs out and he knows no better and he's naked, and that's not appropriate. Just being able to take him to his store, you have to live it, see it, understand it. He's awake all night long. We lose sleep. It affects our health. And unfortunately, my husband does have insurance, but it doesn't pay the bills. I can't even sometimes afford copays. I've neglected knee surgery. I mean, these are things that they're so small, and we're not even asking for what the PCAs are making right now at $18.25. Anything helps, even if it's just to be able to afford our copays. The people that are doing the PCA work, by the way, they are not offered health insurance. So how do you get somebody to come into your home and do those things? And we are compromised at home. So asking anybody to come in is very difficult. I did get COVID, even though I walk around with a mask. This is the first time I feel like a rebel not wearing a mask. People sleep and rest when they get sick. I was unable to do that. My son was staying up until 5 a.m. By the time he woke up, I had work to do. I had to take care of everybody. So it took me a lot longer to recoup. Luckily, I didn't end up in the hospital. I was very lucky. But how many people don't have anybody? And I'm not saying it's going to solve everything. Money doesn't solve everything. But what we've given up is so much, and we're asked so little. We just want to be able to live and be able to provide a safe environment and be able to afford to pay our bills and not lose our homes. And I'm just asking just to see it for that. And I invite anyone to come see how we live. And then I think we wouldn't be sitting here even asking this question to give up the rights, because nobody in their right mind would take on that responsibility.
This is why I was hopeful you were able to come up here.
Thank you, Mr. Chair. I really don't have any questions. I just really wanted to comment, being a mother of a child with special needs. You've done a wonderful job
Thank you.
representing the cause that you've come to represent. And I agree with you. No one should be asked to relinquish their rights to their children, to survive and to take care of them. So I applaud you for being here. I thank you for your testimony. And we will do everything we can to help you and your family, because you deserve the right to stay home with your child and take care of them, if that's your choice. And I'm sure that the job that you left is missing you, but know that the job you're doing is far more important.
Absolutely.
Thank you.